Care that makes a difference. Brought to you by Doctors Hospital of Laredo and Laredo Physicians Group.
People ask me how do they know that they're at risk for heart disease. Unfortunately, sometimes there are no symptoms at all until a heart attack happens. Other times, the classic symptoms of chest pain, pressure, shortness of breath, just not being able to lay flat, are indicative of a slowly deteriorating heart health. Also, people have to be aware if the disease runs in their family. Maybe their mothers or fathers had a heart attack at some point, or some relative. If they have high cholesterol, if they have diabetes or high blood sugars, those are risk factors. If they smoke or they used to smoke, if they're overweight, if they have a sedentary lifestyle, those are all risk factors, especially on adults older than, you used to say over 60, 70 years, but here in Laredo, we've seen patients as young as in their 40s having this type of problems. So it's always good to be aware of your own health, and always very important, visit your primary care doctor, have a frank conversation, and they'll point you in the right direction. Some patients say that, oh, I feel fine, I don't have heart disease, but unfortunately, a lot of the times this can be a silent killer. You know, symptoms might not come until it's too late, or unfortunately, some patients, the symptom could be just dying of a massive heart attack. So it's very important to pay attention to family history, to the other comorbidities that the patient may have, and any symptoms, you know, that something doesn't feel right, so just to have a talk with your doctor.